Hi, I'm here with Dr. Ralph Corsetti and Caroline Graham, his physician's assistant, and I'm going to let them tell you a little bit about what type of medicine they practice.
I'm Dr. Ralph Corsetti. I'm a general surgeon and surgical oncologist by training. I trained in 5 years of general surgery and then completed a 2-year surgical oncology fellowship in the mid-1990s. My practice consists predominantly of breast cancer patients as well as melanoma patients, endocrine patients predominantly. But the significant portion of my practice is the care of the breast cancer patient.
And Caroline?
I'm a physician assistant. I graduated from PA school in 2015 and I had the opportunity to work with breast cancer patients during my surgery rotation. In 2016, I worked at University Medical Center in surgical oncology, and since then I wanted to stay in the field and have been doing so ever since.
Well, thank you both for being here. And was there any specific instance that led you to wanting to become a doctor, or did you always know you wanted to be a doctor? And why did you pick this specific field? What led you to this?
I think I remember always wanting to be a doctor back to probably elementary school or middle school, that early. And so I pursued that goal throughout my entire career. I knew early I wanted to be a doctor. I wasn't sure exactly what kind of doctor I wanted to be. Certainly once I was in medical school, the immediate gratification you get with the effects of surgery and being a surgeon, to seeing a patient be in pain or have a chronic condition that you can take care of and treat immediately and see very gratifying immediate results was very rewarding to me. In terms of taking care of the cancer patient as a surgical oncologist, I do enjoy having relationships with patients. That's a big part of our practice with breast cancer patients, because the prognosis and the survival is so good. We maintain long-term chronic relationships with our patients, and I enjoy seeing them coming back to our clinic every year and seeing them healthy, after they've been diagnosed and treated.
So you do work a lot with breast cancer patients, and as you know, there's a lot of feelings of anxiousness, and people are very scared when they hear that cancer word, and they have a lot of questions, and they may not know exactly what you're saying when you're using all this medical terminology. So Caroline, how do you help ease patients' fears and their feelings of being anxious?
So I always say knowledge is power.
That's
and
right.
We have the opportunity to educate them as much as possible about breast cancer. And in doing so, they can be confident in the steps that they take to move forward in their treatment plan. I think that as you said, we have a unique opportunity to help guide them, but at the end of the day, it's their decision. And I think that we're in a great place to establish these lifelong relationships with them and help them get the most adequate care. And to ease their anxiety, what we tell them is we're going to be here for you every day. We'll be here for you. Whatever you need, you can reach out to us any time of the day, email, phone call. We want to, be your right hand through all of this. So.
That's so wonderful, because it's really comforting to have doctors and physician assistants who really do care.
It gives us, in our practice, in our current situation, we really have the time to spend with each individual unique patient when they're diagnosed. It's not uncommon that we spend an hour to an hour and a half with the patient at the time of the initial presentation to go over all the treatment options, in terms of the types of surgery she's going to have, possible reconstruction methodology and different types of reconstruction, if they're going to need chemo, if we're going to talk about doing chemo first, before surgery, or chemo after. All that's discussed. We give patients a lot of options, and we support them. And at the beginning and the end, we try to reassure them that through screening mammography and the ability to screen breast cancers early and find it early, patients present early and do very well, and so their cure rates are very, very high. And we try to reassure them of that, and we kind of emphasize that at the beginning and at the end, that we're going to get you through this problem. It may take some steps between everything we need to do, but we will typically cure you and get you through the disease process.
You mentioned screening. I know things have come a long way since back when screening first started. What other sort of advancements have you seen? I know you do a lot of research and a lot of studying in your free time. But what other sort of advancements have you seen, specifically in the line of cancer?
I think one of the reasons I enjoy taking care of the breast cancer patient is because it is probably the first cancer that became very public. That goes back to the 1970s when Betty Ford was diagnosed with breast cancer. She became very public with it. It began to receive a lot of federal attention, research dollars, NCI, NIH funding. And so it's probably the best funded cancer. So we've come a long way in terms of molecular genomics, assessing receptors and the biology of the disease. So the advances are, and I've been a physician for over 30 years, and the movement towards less and less surgery. So more and more breast conservation surgery, less and less mastectomy, less and less axillary surgery. Before we used to take lymph nodes out regularly, and now we do sentinel lymph node biopsies. And there's a push that eventually, with knowing receptors and the molecular genomics and the biology of the tumor, we're going to get away from doing any axillary surgery at some point. So it continues to evolve where we're doing less and less surgery. And when we study it, we see that less and less, and we always make sure it's not compromising the patient's care or outcome. So we do studies where we'll compare a standard surgery to something that's a little less, or standard radiation to something that's a little less. So less and less morbidity, complications, and that's why I like the field. And eventually, I think it's a disease that'll be treated medically and systemically, and we won't have to do surgeries at some point for breast cancer.
That would be wonderful. You have been a supporter of Unite for about 7 years now. Why do you think a program like Unite is good for not only the women in our community, but their caregivers as well, and even for the doctors?
I like it because it makes us see the whole disease from the time of the day of diagnosis, when the patient's very scared, anxious, nervous, depressed about what the diagnosis can mean. It goes full circle to where they've typically conquered their disease, have gone through all the treatments, the surgeries, have completed their therapies for the most part, and they're now back in a situation that makes them feel whole, psychologically, emotionally, socially. And it's just amazing to see the patients feel back to being who they were before they were diagnosed, and that's what I enjoy seeing.
And Caroline, we've seen you at several Unite events. What's it like for you to see these patients that you see in clinic or in surgery, and they are terrified, maybe they don't look their best or feel their best, or they feel like they don't look good, and then they've emerged into these beautiful butterflies out on the stage and the runway. What's it like for you to see them?
It's rewarding and amazing to see their confidence. Like you said, when they see us in clinic, they might be a little scared, not quite confident in how they look. And, one of the things that Unite does that I love is scar therapy, and they're able to sit with their scars and, uncover the emotional undersides of what's beautiful about them and what's really tough about looking at them. And I think to share that sisterhood with other women and realize they're not alone in having those scars and going through the same emotional impacts is profound. And I think to be able to, put that down on canvas and express what has been in their head or their hearts that they've been carrying the past few months, it's not easy to do. But at the same time, to watch them stand up and be so proud of that art that they created and what they've gone through, it's beautiful and very rewarding.
That is a really special program. We love the SCAR program. Now, here's a little tricky question for you. If you could sum up Unite in one word, both of you can answer this one. If you could sum up Unite in one word, what would it be?
Celebration.
Oh, that's a good one. Celebration of many things, right?
Celebration of accomplishment.
Yes. And Caroline?
I would say inspiring. I think not only, to each other, the women that are in Unite, but to other women who are going to be diagnosed and potentially need someone else to lift them up in the future.
When you come to these Unite events, you get to know your patients a little bit more personally, and you see them in a different light. But just so we can get to know you all a little bit better, tell us a little bit about your personal life, your family.
Okay. I have a lovely, supporting, caring wife, Gina, who we've been married for 22 years, and we have 3 lovely children. My oldest is a junior in college in Pepperdine in California, and my middle child, my daughter, she's about to be a sophomore. at Samford University in Birmingham, Alabama, and I still have my youngest son, who's at Jesuit High School here in New Orleans, who's about to be a junior.
Great. And Caroline, how about you?
My husband, Jonathan Graham, we've been married for 5 years. We have 2 little boys. One is 4, and he's at St. Therese in Metairie, and the other one is 19 months, and he's at Little Red Cottage Daycare. And I love my family to death. I could not do my job and everything that I do without their support, and just feel very blessed.
Well, you both are very compassionate and lovely people, and we are just so grateful to have you as a Unite sponsor, and we love seeing you there. And hopefully we'll see both of you all at the October 1st event, Ribbons Rock the Runway. It's going to be a great day, and we're going to try to set a world record. So hopefully you all will be there. Thank you for all your sponsorship and your support.
Thank you.
Thank you.
I will fight. I will fight for you. I always do until my heart is black and blue. And I will stay with you.